sufficient to just have a mental illness.
I just want to talk about the vampires some more. Did you talk to Ms. Stauch about her experience with vampires during your forensic interview?
I did.
Tell the jury about that.
Ms. Stauch introduced a vampire called Justice. She said that there was a button in her cell that she could summon Justice, Jasper, perhaps Patrick, if I remember correctly. She said she had been introduced to vampires when she lived in Alaska previously. And they used to go door to door like Jehovah's Witnesses. And she didn't really offer them in any kind of meaningful way, like wasn't explaining anything or trying to use that information necessarily. But she certainly referenced them throughout the interview.
Did she tell you where she got these names for these so-called vampires she's talking about?
She directed me to the movie Twilight.
And did you find out that these names were from the movie Twilight or the book series involved in Twilight?
Yeah, a few of them for sure. I'm not familiar with the series myself, but I Googled. She talked about a vampire council, and the name of the council was taken directly from that series. And then a couple of the names for sure came from there as well.
And is that something that would be common with someone who has dissociative identity disorder, that they would be able to tell you exactly where the names of other personalities came from and things like that?
Are you drawing a connection between the vampires and DID? Because I got a bit confused there.
No, I'll ask you a different question. What relevance, if any, did that have in your evaluation? The fact that she's talking about vampires that came from a movie.
Well, certainly if somebody's talking about vampires and that appears real to them, that could signify that they're experiencing a mental illness. So I looked further to see, I'm looking for consistency again. So it was notable that she said that she had been interfacing with these vampires since Alaska, but she made no mention of them to the previous evaluators. And she also didn't mention them throughout her jail stay until several months in. I think I lost track of your question. I'm sorry.
Well, what's the significance? It's one thing to say that I talk to vampires and I see vampires. What's the significance of her saying clarification? Well, these vampires came from a movie.
Right. So that's not consistent with a mental illness. It sounded like a fabrication. If people are talking to vampires, I would expect them to have their own unique aspects to them and something unique to the individual that would make sense in a greater scheme of how they see the world. And it just seemed like she was conveying a story essentially from fiction.
And did she bring this up on her own, or did you ask her questions that might trigger that answer?
I didn't ask her any questions about vampires initially.
Okay. And I forget the term you used to describe how she was talking to you, but she likes to talk, for lack of a better way to say it, right?
Yes.
Would she just volunteer information to you and change subjects as you're talking to her?
She didn't change subjects a whole lot. I didn't get the impression from her that she wasn't following my line of thought. She was telling a coherent story. She just gave far more information than was necessary to answer the question.
Okay. Did you perform any psychological testing with Ms. Stauch?
I administered 2 measures to assess for genuine responding for her mental illness symptoms.
And what were those measures?
The MFAST, which is a Miller Forensic Assessment of Symptoms test, and the SIRS-2, which is a structured interview of reported symptoms.
And what were the results of those psychological tests?
So she exceeded the cutoff on the MFAST. It's a screening measure for feigning. And feigning means the intentional exaggeration or production of mental illness symptoms. So she crossed over the threshold, indicating that she might in fact be feigning, but because it's a screening measure and it wasn't 100% sure, I gave another more comprehensive measure. On that measure, there's several scales. It looks at different aspects of feigning. Are you reporting symptoms that you're not manifesting observable behavior of? Are you reporting inconsistent symptoms? Rare combinations of symptoms. So she just elevated one scale on that test, suggesting probable feigning. But on the test overall, it was indeterminate.
In your report, it indicates that she yielded a total score of 12. Do you remember what test that was on?
That was on the MFAST.
And what does that mean to you as a psychologist?
So the cutoff in the manual is 6. So if you score anything above 6, it's presumed feigning. But because it's a screening measure, there's a lot of false positives. So they suggest you do more testing. So it's out of 25. If somebody scores over 16, it's like 100% rate of also elevating the SIRS. So at 16, you don't have to give the SIRS as well. So 12, it was certainly elevated. I had concerns, but I wanted to be thorough. I didn't want to just, it's a very prejudicial term to say somebody's feigning or malingering.
Sure.
So I just was being prudent.
Okay. Well, in your report, you indicate that such a score is highly suggestive of malingered psychopathology and indicates the need for further assessment. What did you mean by that?
And that's taken from the manual. So because it is high, most people don't get that score by accident. However, because it's a screening measure, it's not very sensitive. You're going to get false positives. People are going to look like they're feigning when they're not feigning in that scoring range. So that's why more testing is done.
What does the term malingering mean?
Malingering, excuse me, I'm sorry. Malingering is like feigning where you're intentionally exaggerating your symptoms, but with malingering, there's an added element of the presumption of trying to obtain a secondary gain.
Did you see that in this case?
It certainly seemed that Ms. Stauch was presenting symptoms that she didn't appear to have. I can never know if somebody is trying to achieve a goal or not. So I didn't offer an opinion on malingering, but certainly there were suggestions that she was not as impaired as she was portraying.
Did you diagnose Ms. Stauch with anything or any mental disorder out of the DSM-5 as a result of your competency evaluation?
My diagnostic impressions were that she had some personality dysfunction, both with traits of borderline personality and narcissistic personality, but not meeting threshold for either full disorder. And I offered a rule out of PTSD versus an unspecified anxiety disorder. I just didn't have enough information. And given that it wasn't a clinical information and I wasn't there to help her, I didn't want to probe too much into her trauma.
Did that have any impact on your ultimate conclusion with regard to competency, either of these diagnoses?
Well, those diagnoses would not really reach the threshold of a mental disability.
Is that why you didn't go further and try to rule out post-traumatic stress?
Whether or not she had post-traumatic stress, she did not demonstrate functional impairment as it related to competency. So for my purposes, it wasn't important.
Okay. So what does it mean when you say other specified personality disorder with borderline and narcissistic features? Can you break that down for the jury?
So personality disorders, just like other clinical disorders, have certain criteria that need to be met. And you have to have so many. I believe there might be 7, and you have to have 5 of 7 for each one. So in my impressions of her, she had a couple of features of borderline personality disorder. She was impulsive. She had some kind of push-pull relationships. I don't know what Dr. Moore testified to yesterday, but there was insisting that she saw Dr. Moore, and then Dr. Moore would show up and she'd refuse to see her. That's quite consistent with a borderline personality. And the same for narcissistic personality. Those features are typically a sense of entitlement, grandiosity, a lack of empathy are 3 big ones. Ms. Stauch told me on 2 occasions during the interview that she lacked empathy and she didn't experience people's thoughts and feelings. She had grandiosity throughout our meeting where grandiosity. Thank you. Throughout our meeting where she touted her accomplishments, her intellect. She was refusing to meet with people that didn't have the highest credentials. She didn't want to meet with social workers. She wanted to meet with people with higher degrees in order to talk about her problems. Wasn't sure that she met all the criteria for the disorder, so I was just trying to convey, my goal in an evaluation is to try to help the person reading it experience what I experienced meeting with her. And her personality was very much at the forefront of our interactions. So that's what I was trying to convey.
Did she ever refer to you as being an actress?
She made a comment. She said, "I think you're an actor." And then she just continued talking to me. Like, she didn't really have the concern.
Was that about the time you were introducing yourself and saying what your role was, or at what point did that come up?
No, it was somewhere in the middle.
Okay. There's a couple things I want to talk about, the borderline, well, the personality disorder diagnosis that you have in your report. Are you familiar with the term transient episodes of psychosis?
Yes.
What is that, and what does that mean?
Well, transient means it comes and goes. The psychosis, per the DSM, the psychosis that can go along with borderline personality disorder is typically related to fears of abandonment. The disorder itself is an attachment disorder where people, the primary goal is to not feel abandoned. So there's these desperate attempts to keep people in your life, at the same time pushing them away. So the transient episodes of psychosis that the DSM refers to is kind of a paranoia about abandonment that might manifest like you text your loved one, they don't text back as quickly as you think they should, and you start thinking that they're leaving you. And then you go into a spiral thinking that the relationship is over, and then they text you again and they were busy, and then you're like, oh, I'm fine now. That would be considered a transient episode of paranoia.
Okay. Seems like that's pretty common, at least. I hear about that on occasion. Did you see any of that with Ms. Stauch during your evaluation?
No.
Is that something that are you capable of ruling that out as a symptom or being anything to do with Ms. Stauch?
It wasn't something I observed during my interview. She has personality dysfunction that I wouldn't say I would rule it out as ever being possible happening. I didn't see it firsthand.
So it didn't come up?
No.
Right. I want to talk to you a little bit about what she, well, let me ask you this. Did she talk about Gannon and Gannon's death?
A little bit, yes.
Did she talk about feelings that she wanted to bring him back to life?
Feeling that she could bring him back to life.